the general menu. Let me now come at the start of our press conference with the Commissioner on our Europe Beating Cancer plan. Those of you who know things, the history of this, you would remember that this was one of the themes that was developed during the last campaign for the European elections in 2019. It was also a major political priority for the new Commission and the central pledge that we are now today honoring. I still have the memories in my mind of last year in pre-pandemic times on 4th of February in the full house of the European Parliament together with MEPs, associations, patients, industry in launching the process that has taken us to today's action plan. Since then, of course, we had the pandemic, and the pandemic had an impact, of course, on many aspects of the disease, and also had an impact on our preparations, but did not have an impact on our political commitment and political willingness to deliver this proposal. In the meantime, we have launched a very ambitious consultation process that yielded around 2,500 contributions. And today, we are very happy, and may I say proud. It's one of these good days in politics when you know that you fight for a right cause, that we present this plan, which is a holistic, inclusive, anthropocentric plan. Above all, it is about what the European Union does best, which is bringing together ambitious goals, setting deadlines, activating funding, and bringing together the main actors and players in effective and lasting partnerships. This plan, as the Commissioner will explain in more detail in a while, covers the main strands of the disease, namely prevention, diagnosis, treatment, and survivorship issues. And it's structured, I would say, around certain key words, certain key premises, which are at the heart of our ambitions for the years to come. First, equality. Everybody matters, and the chances for treatment or surviving cancer should be the same for all Europeans, regardless of the socioeconomic status or the place in the European geography in which they live. There should be no first and second class cancer patients. The second premise is innovation. We deeply believe that innovation will drive change and will bring hope. We will maximize research, data, and new technologies to improve diagnosis, find new promising therapies, and foster the potential of personalized medicine through tailor-made strategies. Third premise, delivery. We will concentrate on specific, tangible, and realistic targets. We want to create a tobacco-free generation of Europeans. We want to break down the target of smokers in Europe down from today's 25% to 5% by 2040. Same goes to the harmful consumption of alcohol. We want to bring it down to 10% by 2025. We have identified testing capacities that we need to see improved. And let me give you 3 specific examples of delivery that will matter. First, the creation of a knowledge center on cancer that will facilitate the coordination of scientific and technical cancer-related initiatives. Secondly, the creation of a very important European Cancer Imaging Initiative to support the development of new computer-aided tools to improve personalized medicine and innovation. And finally, the development of a new cancer screening scheme, a very ambitious scheme to ensure that 90% of the target population is offered breast, cervical, and colorectal cancer screening. So this on the terms of the delivery. Nothing will happen, of course, without money. and we're bringing together in this equation an ambitious envelope of 4 billion euros, drawn not only from our research and structural funds, but also from the new EU for Health standing program that we have presented last year. And finally, another key premise that I would like to highlight, and probably that shapes our work in here, that this is a typical example of health policy beyond health policy. This is a new planet in this constellation of the European Union's health union, but it's not only consistent of health instruments. We bring together this whole of society approach, bringing together important contributions from the employment, energy, education, marketing, agriculture, environment, climate, transport, social policy, equality, and taxation. All these policy areas bring significant contributions to this plan, and I want to take the opportunity to thank not only Stella Kyriakides, who is the central player in this team, but also the many other colleagues that participated actively in the commissioner groups for this plan that I had the honor to organize a few months ago. I was surprised to see at least 13, 14 commissioners actively contributing to this ambitious. So I will leave it here. I will pass the floor to the Commissioner for more details.
Thank you. And ladies